Hi, welcome everybody. It's me, Dr. Khalid Sadek, and you've tuned in to another episode of Medical Mysteries, your Friday night special where me and Mr. Ahmed, a resident physician, specializing in a whole host of things, we discuss medical mysteries and it's an open chat, it's an open forum. Today's discussion, we're going to be covering laughter. How laughter is the cure of all diseases and laughter as a disease itself. So laughter, two sides of the coin, laughter as medicine and laughter as disease. Welcome, Mr. Ahmed, thanks for joining us today.
Hi, Dr. Khalid, and thank you once again for inviting me to your medical mystery tour. I'm super excited about today's topic. It should prove very entertaining.
Yeah, absolutely, thanks. I mean, we've done this for the Halloween where we covered all sorts of lumps and bumps and ghosts and ghouls, people rising up and hearing things and seeing things. We also covered people allergic to water. So it's interesting stuff. So today's talk is going to be about laughter. So I think we're going to first be talking about laughter, what it means to the body to laugh, and is it good, is it bad? I think we all know it's pretty good. And then the second half, we'll be discussing laughter as a disease, and we'll be showing clips and examples of people who suffer from pathological laughter. So, with no further ado, let's crack on. Laughter. So, Mr. Ahmed, we all know that laughter has a profound effect on people's health. I think it's fair to say when you're laughing, it's really hard to be sad. I think that's fair to say, goes without saying. And even if you are very, very sad and you do end up laughing, then everything changes. It's like that cloud lifts above you. So there must be something in the physiology of laughter that causes that change. And actually it has been studied. One of the main things that laughter does, from what I've been reading, is that it relaxes a lot of the muscles. It relaxes the body for up to 45 minutes. So a lot of people have incorporated laughter in yoga and meditation. So you can find a lot of information on yoga and laughter. So that's one example of how you're using it practically. We also know that laughter is it's a good way of boosting a lot of neuropeptides. So we're boosting things that make us feel good, such as dopamine and oxytocin. Things that, Mr. Ahmed, you probably have come across a lot in your line of work. Is that right?
Absolutely. So, laughter is an incredibly fascinating topic, partly because, and unsurprisingly, the brain has a center dedicated to the propagation of both laughter, happiness, and sadness. And as you mentioned, laughter specifically is something that triggers the release of those happy hormones, the happy neuropeptides that make us feel better and well in ourselves. And oddly enough, the laughter brain center is called the facio-respiratory center, and that's located in the cerebellum and in the brainstem. And there's complex wiring between the two centers to form the laughter center. And I can see you smiling away because, as always, the brain is an incredibly complex structure.
Absolutely.
As you very well know. And it's this very center that is involved in the coordination and expression of laughter. It's a complex network, so you feel happy, you smile, you have a recollection of something that makes you happy, that releases those happy hormones, those endorphins, those natural opioids and oxytocin, and you feel well in yourself. And that's why they say laughter is the best medicine. And the activation of those neurons results in a certain expression on your face. You know when someone's happy, you know when someone's smiling. And that very act of smiling or laughing, expressing happiness, makes you feel relaxed. Not only does it release the facial tension in your face, it's well known that it's easier to smile or laugh than it is to frown. In addition, the release of those hormones and those neuropeptides makes you feel well. So absolutely, Dr. K, I think everyone should get a prescription of laughter.
So we're not saying it's only good for you internally in terms of boosting up your mood and relaxing muscles, but actually when you laugh, you also increase your social interaction. That's to say, that you become more personable. Everybody likes to have a happy, funny person around them. And we've also found that not only does it increase your social interaction, but it can also increase your romantic interactions. In fact, studies have shown that those people who laugh as a couple stay married longer, and that those who continue to be happy and laughing will also live longer than individuals who don't laugh as much as we should be doing. Okay, so that's quite interesting in itself. Having said that, not only does it make you feel good and sort of make you popular, but it's also, which is actually something we really need given the fact that we're undergoing what seems to be one of the most traumatic elections ever. I think we all need a bout of good laughter to get us through what is going on. But also, when we think about COVID-19, we also know that laughter can actually boost your immune system. How do you think about that? I've been finding out a lot about laughter, and in particular, it has a magic effect on white blood cells. That is to say, the part of the immune system that fights things like cold or bacteria or viruses. We've seen that studies of people's blood samples have seen an increase in what we know as natural killer cells. That is to say, cells that are involved in the immune system directly. So not only is it good for boosting your mood, increasing your social interaction, relaxing your muscles, making you feel happy and relaxed, but it can also boost up your immune system. And the flip side of that is if you're happy, it also counteracts depression and other sorts of mental injury. In fact, laughter has been incorporated as a tool in medicine. A lot of hospitals now have hospital clowns. I don't know if you've heard of this, Mr. Ahmed, but there is a school of thought that actually wants clowns or entertainers to go into hospitals and cheer people up, mainly on pediatric wards, but also on wards for adults as well. And celebrities, lots of famous people have come onto wards in costume dressed as character. Because what we've found is that laughter, not only will it get rid of depression and boost your immunity, but it can also alleviate pain. So things like back pain, chronic pain can also be depressed if you're happy and cheerful. Now, I know that you're a specialist in back pain and pain management, Mr. Ahmed. How do you feel about using laughter in that context?
So, exactly as you said, Dr. Collett, laughter is a very powerful medicine. So if you think what the opposite of laughter is, the opposite of laughter is stress, tension, and sadness. And they're associated with the stress hormone cortisol. When we're stressed, we feel tense, we feel under pressure, we feel anxious, we get achy bones, and we get tension across our shoulders and our neck. And we've all experienced it when we've had tension, because we get that ache in the back of our neck and we just don't feel well. And that's because the stress hormone cortisol is firing off and really pushing you, and it's a stressful response. Laughter is the opposite of that. It releases those natural endorphins, that dopamine, the oxytocin, all hormones and neuropeptides that act to relax you and relieve muscle tension. You know when you've had a good cackle, your ribs start to hurt, and there's a reason for that, because you've activated those intercostal muscles, those chest muscles, and they've tensed up, flexed and contracted and relaxed, and you've released that tension, and that's the beauty of laughter. And similarly, if you're tense all day long, you notice that your posture changes, you get tension in your back, you develop muscle knots, which we've all had to see physiotherapists and massage therapists for. So it is truly a wonderful, wonderful remedy for all ails, for many, many ails.
Interesting. So not only is it good for your immunity, removing ails and diseases such as chronic pain and depression, not only does it increase your social interaction, your chances of longevity, living longer and having a more fruitful relationship, it goes deeper than that. Like I've also found that from my work and research is that those who are able to laugh about things, whether it be good or bad, are actually, as a person, they're a bit more resilient. I don't know if you've ever got a boss who, or yourself, or when faced with adversity, if you can laugh, it also makes you a little bit stronger in pushing through those troubles. So laughter also seems to be a personal trait if anything, in terms of making the individual a bit more resilient. And everyone knows you can't be a good laugh, right? Now,
I mean, you're absolutely right, Dr. Collett, because positive mental attitude is one of those things that's associated with longevity. If you have a positive mental attitude, if you're able to laugh when you should laugh, if you're able to smile when you can smile, and if you cry when it's appropriate to cry, that means you're plugged in the right way. That means the circuitry in your brain that controls those responses is being utilized, and the fact that they're being used, that's a healthy sign.
yeah.
It's unhealthy to not laugh.
So, what happens when we turn the coin? What happens when you can't stop laughing? What happens when laughing becomes a disease? Now, this is the second half of today's discussion. So far, we've spoken about laughter as medicine. But, like all good medicine, if you take too much of it, it can have a diverse side effects. So, the second half of today's talk, we're going to be discussing the second upside of laughing too much or laughing as a disease. So, we'll have a quick break and then we'll get back to discussing laughter as a disease.
Welcome, I'm Dr. Karlitzek, and you're watching my fantastic world of cysts and lipoma removal. I'm Dr. Karlitzek. Welcome to Medical Mysteries. Every Friday at 9:30 Greenwich Mean Time.
So, welcome back, everybody. Hope you had enough time to enjoy the intermission as well as get yourself maybe a cup of coffee or a cup of tea. So, the second half of this discussion is laughter as a disease. And I think before we go into that, I think maybe, Mr. Ahmed, if you can just open the discussion on this, and then we'll go and watch a video of someone actually suffering from this exact condition. What do you reckon?
Yeah, I think that's a cracking idea. We've talked about laughter as a drug, as a cure, and the flip coin, as you said, is laughter as a disease. And there is a condition called pathological laughter syndrome or uncontrollable laughter. And unsurprisingly, that's due to a lesion or a set of lesions in the brain that gives rise to uncontrolled laughter, inappropriate uncontrolled laughter. It is a debilitating condition, it's a serious condition. It is rare, thankfully, but patients that have it, they have uncontrollable or subject to uncontrollable episodes of laughter, and they occur without an apparent trigger or and it's, in essence, a disorder of emotional expression rather than a disturbance of feelings. So these patients, they don't feel happy, they don't feel sad. It is merely an imbalance of the balance of emotion. Instead of triggering crying when you should feel sad, they just laugh, and that's as a result of an abnormal stimulus. And it's not that they feel happy.
Okay, okay. I think I think the best way to kind of visualize this is to see someone going through one of these episodes, and then maybe we can review that and see what the impact of that is, because it sounds very, very debilitating. Let's cut through to that now and have a look. So, I mean, look, I mean, that was quite an unpleasant situation. Even just watching it made me feel a little bit uncomfortable. Take us through what we just saw, and how can we describe it?
So this is really classic of pathological laughter syndrome. What you saw there is this gentleman who unfortunately has this condition, and what's happened there is that he's had a stimulus, and that stimulus may not be that he feels happy or sad, but it's caused a trigger. For example, it could be that he is starting to laugh in response to sad news, or he could start to laugh because someone's moved their hand from left to right, or he's seen a bird land on a tree. And it's abrupt, and it can last from 30 seconds to 2.5 minutes. And as you can imagine, it's quite disturbing because often it's unprovoked. They don't know when it's going to happen. And it's not an enjoyable experience. It's not associated with the release of those hormones and those neuropeptides that we would release if and when we felt happy.
Yeah.
And I think, and excuse the pun, it's not a laughing matter. It is something that is organic, it has a root cause, and it's clearly very difficult to live with.
Yeah, yeah. I mean, looking at that video, that individual, it almost came spontaneous. It didn't. There didn't seem to be like something funny for him to do. It's just an uncontrolled spasm almost. In fact, his body spasmed so much that at one point I thought he may be almost choking. He's almost died of laughter, and it didn't look very comfortable for him at all.
That's a very, very good point. So the centre for laughter in the brain, and I have to admit, I've just glanced over the different questions that we're getting through, and someone asked where that centre would be. And I think we've got a slide somewhere that we can just quickly pop up. There is actually a centre associated with laughter and crying, and you would be surprised. And again, it's a question asked by Curly SP, I think I saw on there. Is there a syndrome called pathological crying? And oddly enough, both the actual syndrome of pathological laughter is called pathological laughter and crying, because they are both associated with a specific area in the brain, and that's the area in the brain which is a facio-respiratory centre, which controls our ability to laugh. And as the name suggests, the facio-respiratory centre, it controls facial expression and breathing. And as you saw, that gentleman, he had specific facial expressions of laughter. He made the sound of laughter, but he was clearly also gasping for air and struggling to breathe. And that's because of an abnormality in the circuitry associated with the activation of that brain centre. So, when you and I have activation of that brain centre, it's because we feel happy and we want to laugh. For him, it's an abnormal stimulus. A certain stimulus, it could be, someone laughing or someone crying or a loud noise, would trigger this event, and you activation of that brain centre, and that's called abnormal activation.
Okay. So, are these people born with this syndrome, or do they acquire it? How does it come about?
So excellent question. So The vast majority, of the case reports in the literature, and there is an increasing body of literature regarding this condition. The vast majority, if not all of them, display an abnormality in either the cerebellum or the pons, and that results. And you put up Paul Pugh, who's a perfect example of this. Paul, unfortunately, I believe, was involved in an altercation with some thugs. He was attacked. He sustained a brain injury. And as a consequence of that brain injury, he developed pathological laughter and crying syndrome.
Really?
In addition to brain injuries, brain tumours can cause it, strokes can cause it, certain infections, such as an encephalitis, an inflammation of the brain, can also give rise to it. And we say pathonomically, specifically on the MRI scan, there are very specific lesions, abnormalities on the MRI scan which are located within the cerebellum and the pons, which is all part of the hindbrain. And it's these lesions that cause a disturbance in the network, i.e. the connection between the nerves that make up your faciorespiratory centre, your laughing, crying centre. So, in essence, your control box, your black box for laughing is the same control box, black box for crying. And I saw another question quickly shoot up by...
Yeah, of course, go for it.
And it was, is there anyone famous or any famous characters out there with this condition? And we've all seen Batman. And I think we've got a slide of the Joker. Where's the Joker gone? Have you got him? Have you got him there?
Yeah, he's up. He's up. We can see him.
So the Joker, Arthur Fleck, I believe his name, characteristically would laugh and smile at the most inappropriate times in the Batman movies. And that's because he also had pathological laughter and crying syndrome. So he would have these outbursts of laughter, and he'd often cry as well. And he's probably one of the most famous characters with this syndrome.
Yeah, fine. I mean, it's fascinating that disease that we see in clinic becomes almost popular culture, and people just not connecting the two. But often, things we see in art mimicking life it's there for us if we know about it. It's very fascinating. I didn't really put the two together until you kindly put that through. So you know in the brain exactly the part which is affected and can result in this pathological laughing. I think we've all seen the Joker. I think we've seen those episodes. We've seen it in how brain injury. You demonstrated of Paul Pugh how he had traumatic brain injury, almost like a stroke, and instead of losing speech or limb function, the brain has lost the ability to control that spasm of laughing. If we know where in the brain it's happening, is there any way for us to control it, to medicate it, either through a medicine or an operation or through maybe brain stimulation?
So if we go back to the area of the brain that has an abnormality within it that results in this, the cerebellum. The cerebellum is called your hindbrain, and unlike your forebrain, which is the classic picture of your brain that you see, which is located up here, the cerebellum is important in the automatic execution of what we call innate or previously learned movements. So when you tickle a baby, they laugh. That's something hardwired and learned. So you're born with that ability to laugh. You're born with that ability to cry. That's hardwired in your system. And it's the disruption of that network that results in this really rare and very interesting and fascinating syndrome. Unfortunately, we haven't actually, because it's such a rare condition, the pharmaceutical companies haven't really had to focus their attentions on it because it's so rare. What happens is patients with this specific syndrome will learn to prime. So they will learn situational points where they will try and avoid triggering their episodes of laughter or crying. But as far as I'm aware, there's no pharmacological therapy for it, and certainly there's no role as of yet for deep brain stimulation. So obviously deep brain stimulation is well utilised in movement disorders, increasingly in depression and some other psychiatric disease. But for this, it really hasn't been tried yet.
Interesting. So one of our astute viewers, G, has put a question: does laughing gas actually make you laugh? Very interesting. So, nitric oxide, which is the chemical compound in laughing gas. For those of you who have been on the maternity ward and had a quick blast on the nitric oxide, it's actually an example of a product which can make you laugh, but also alleviates pain. And I'm not sure if it's the laughter that eliminates the pain, or whether it's the nitric oxide compound itself that is a sort of a pain relief. I don't know what you think about that, Mr. Ahmed, but laughing gas, which can simulate laughter, I guess it's a bit different to inhibiting it, but there's a drug there that can mimic the process of laughing.
So nitric oxide, I believe, is the active ingredient of laughing gas. Correct me if I'm wrong, Dr. K.
Yeah.
Nitric oxide is actually a really potent neurotransmitter. It acts both on the walls of vessels within the brain and all over the body, and it can cause vasodilatation, an activation of different areas of the brain through increased blood perfusion will obviously trigger these kind of events. And I believe that's probably how it works in that setting. I'm not entirely sure how it acts as a painkiller, but I think that's probably something you know more about than I do.
Yeah. Look, I'm going to keep crack on with some of these questions because they're coming in thick and fast. We've got Kelly saying, could her laughing cause her hernia? Now, I mean, I don't know where her hernia is, but she's saying that she laughed so hard that I'm presuming it was like a femoral or inguinal hernia lower down, and has actually caused her a hernia. Now, for those of you who aren't familiar with the hernia is a protrusion of the content of the abdomen that goes through the muscle wall and comes out through the skin. So the muscle wall is your rectus abdominis, you know, that six-pack of muscle, but behind it is a lot of bowel, your colon, your ascending colon, your descending colon. Now, if you increase your intra-abdominal pressure, that's the pressure inside your tummy, either through straining or I guess laughing, because that increased cavity pushing down, that diaphragm, the lungs pushing down, it can certainly increase the pressure inside your tummy. And if there is a weakness in that abdominal wall, yeah, a bit of bowel may push through and cause that hernia. Often it's a reducible hernia, that is to say that you can push it back in, but certainly a hernia nonetheless, Kelly. Great question. Ms. Rahman, what do you feel about hernias anywhere else? Can you develop hernias anywhere else from laughing? Can you think of anything that might spring to mind while I have a look through some of these awesome questions?
Yeah, I mean, I think you're absolutely right. So again, if we think about the name of the laughter centre, the crying centre, it's the facio-respiratory zone. And as the name suggests, respiratory. When you laugh, you're breathing in, you're tensing your muscles, and we all have a good chuckle. And when I mean a really good laugh, when someone tells a joke or something really funny happens, and you have a good cackle for a couple of minutes, you do feel that your ribs hurt afterwards, and there's a reason for that. Because you've got activation of all the muscles in your chest cavity, both your intercostals, your externals and internals, the muscles in your abdomen, and it's that repeated tension and pressure, as well as the intra-abdominal pressure, that gives rise to someone suffering a hernia. It's like if you carry something heavy in the gym, or carry something on a building site or whatever, and you're not prepared to carry it, and you carry it with poor posture, you can really affect certain weak areas, as you mentioned, femoral or inguinal, or even hiatus hernias through the diaphragm, can arise as a result of that difference in intra-abdominal pressure and chest cavity pressure, as well as abdominal wall weakness. So yeah, absolutely, that's a cracking question.
Interesting. I got a question here coming through. Let me just pull it out. Let me just one moment. Let me just find. I've lost it again. It was from Bridget. Where was it? Where was that question? Let's have a look. So she says, so if part of the brain controls both laughing and crying, Why do we laugh so hard when we cry? Mixed up signals. You mentioned the same part of the brain, the facio expressive part of the brain in the cerebellum that controls laughing and crying. I guess if you're laughing or crying too much, can there be an overspill, a bit of overlap in the neurons? Can some signaling be messed up if it's overstimulated?
Yeah, absolutely. So what we have, and again, an amazing question and really appropriate because it is the same centre and it may very well be an overstimulation. It's often the case when you've had such a good laugh, you shed a tear. That's not uncommon. But you don't feel sad when you shed that tear or when you start crying. And that's the critical point here. And I saw someone else mention the question about these people, these cases who have this excessive laughing, do they get benefits from it? Do they have all the benefits of having a good laugh? That's the big difference. They don't. So when you have a really good laugh and then you shed a tear, what's happened there is that you've released all those endorphins, all those natural opioids, all that oxytocin, and you feel well and good.
Okay.
And it's the same centre that causes crying, so maybe there's overspill and you cry, but you don't feel sad after you've had a good cackle. Now, those patients who have this disorder, they don't feel happy after these outbursts because the circuit is not located in one place. The circuit is located in different regions of your brain, but the executor, the output of laughter, is located in your pons and your cerebellum. And it's the abnormal activation of that centre that gives rise to them having that outburst of laughter or crying. The preceding event, which is you actually feeling happy and the associated memory of being happy, doesn't exist. Those other regions of the brain, the amygdala and the hippocampus, are not activated. And therefore, those other neuropeptides and neurotransmitters that are associated with us feeling happy and being happy and laughing are not there.
Interesting. A lot of questions trying to connect tics, physiological tics, such as those you might find with Tourette's, and also associating it with a laughter. But it's not quite the same, is it? What we're saying is that there is actually a brain injury which is causing this particular episode of laughter. You mentioned brain trauma, strokes, tumours, while Tourette's is more sort of like a behavioural issue, which can be kind of like overcome. But if there's actually a structural part of the brain that's injured, then that's much more difficult to treat. And people have said they're kind of giving in their own advice. They're saying some of their relatives have Tourette's, but they don't have this laughter component. So that's really interesting, isn't it? So a bit of information coming in through the chat. Well, listen, Mr. Ahmed, it's been a fantastic chat. Really fascinating, always to talk to you and learn about the most complex parts of the brain. And today's episode has been no different. We've spoken about how laughter is both a medicine and a disease, the same coin but two different sides. We've spoken about how much benefit laughter can be, especially in times of trouble, anxiety, how it can also boost your immunity, your interactions, your social bubble. We've also spoken about how it can present in disease, both in malignancies, trauma and stroke. We've seen videos, very distressing videos of individuals suffering with bouts of laughter, not a laughing matter. Mr. Ahmed, do you have any closing remarks to share with our fantastic viewers?
Please keep laughing, remain happy.
Yeah.
It's really important. We're all experiencing very difficult times across the world, especially with COVID and all the unrest associated with it. It's really important to keep smiling, laughing, telling each other jokes, and just doing our best to brighten up our days.
Wonderful. Lovely message there. Well, listen, it's goodbye from me.
And it's goodbye from me.
Bye-bye, everyone.
Bye-bye.